Hello everyone. Today, we are going to discuss about propranolol. Propranolol is an adrenoreceptor antagonist classified under beta blockers group. Beta blockers reduce your blood pressure. Propranolol is a non-selective beta blocker, which means it acts on both beta-1 and beta-2 adrenergic receptors, blocking the binding of epinephrine and norepinephrine. Propranolol is marketed under few brands names such as Angelol, Ciplar, Dositin, Indrol, Cardinal, Darolin, Duranol, Inaprin, Profilux, and Sumyol. History of propranolol. More than 100 years ago, early investigators discovered that epinephrine and norepinephrine cause pharmacological function. In 1948, Ahlquist published a seminar paper that he found alpha and beta adrenoreceptor for catecholamine drug and cause effect on the muscle. In 1958, DCI-dichlorosoproterenol was discovered by a Eli Lilly group. The synthesis of DCI confirms that beta receptor can be blocked. DCL has no clinical utility. Thus, the chemical structure of DCI was changed to produce propranolol. In the early 1960s, James Black, a Scottish pharmacologist, was working on a series of beta-adrenergic blocking compound called propranolol and propranolol to relieve angina pectoris that result from oxygen deprivation in the heart. He wanted to invent drug that can decrease the requirement of oxygen in the heart. In 1962, Dr. Black created propranolol. In 1963, propranolol shows thymic tumor on mice. Thus, this drug is used in life-threatening situation in angina and arrhythmia. In 1964, Dr. Black created another beta blocker called propranolol, a non-selective beta blocker. In 1965, propranolol was tested and had higher potency with fewer side effects. Propranolol became best-selling drug to treat wide range of cardiovascular diseases such as hypertension and hypertrophic cardiomyopathy. How does propranolol work? Beta-1 and beta-2 receptor are G-protein couple receptor. When the beta blocker blocked this receptor, norepinephrine and norepinephrine cannot bind to the receptor. When the receptor is deactivated, intracellular CAMP cannot be stimulated by adenylyl cyclase. Then, CAMP cannot activate protein kinase that phosphorylate the calcium channel. This decreased the release of calcium from the sarcoplasmic reticulum into the cytosol. After that, calcium cannot bind to the troponin. The myosin binding site is not exposed. As a result, myosin cannot bind to the myosin binding site. Thus, cross-bridge cannot be formed. At the end, the muscle relaxation increases. Now, we are going to talk about drug discovery. In the early discovery of propranolol, it was generally used to treat hypertension. However, scientists also found that propranolol is a good drug for infantile hemangiomas and anxiety. Infantile hemangiomas are proliferative vascular tumors. It may cause pain, bleeding, or functionally impairment with potentially life-threatening consequences, and it often occurs during childhood. Previously, IH were treated with corticosteroids. It causes adverse effects, adrenal suppression, hypertension, and growth impairment. However, in 2008, French investigators accidentally found that propranolol can treat the disease as it causes changes in color and no regrowth. In addition, propranolol had shown benefits to curb anxiety. Basically, propranolol works selectively by blocking the effects of norepinephrine. Thus, it inhibits the reconsolidation of fear memory and make people more relaxed. Scientists from University of Amsterdam performed an experiment on 45 people where they were given propranolol or placebo. Consequently, they found that subjects who consumed propranolol succeed to overcome the fear when facing with the spider, while the others failed. Now, we are going to discuss about the drug design. The lead compound of beta blocker is the dichlorosoproterenol. The dichloroisopretanol is then developed to propranolol. However, propranolol can cause tumor in mice, so it was only used in life-threatening situation. Propranolol is then discovered by addition of ether functional group. Before the drug undergo the clinical testing phase, it will undergo the in vitro and in vivo testing. The reason why the in vitro testing used is to provide the information on ligand affinity, selectivity and efficacy. Appropriate in vitro models can predict the in vivo performance. Like example, several types of beta blocker were tested for anti-proliferative properties in combination with chemotherapy in vitro. The most potent drug combination were evaluated in vivo in the mouse model. As the result, propranolol exhibit potent anti-cancer properties in vitro testing. While, in vivo testing, propranolol transiently slowed tumor growth and metastatic tumor cell growth block. Then, let us move to the dosage formulation. Usually, propranolol is administered through oral routes in form of tablet and oral suspension. Propranolol is usually been used to treat the person that have hypertension, myocardial infarction, chest pain, and abnormal heart rhythm. For the hypertension patient, the normal dose that are given is 40 to 80 milligrams 2 times a day. Furthermore, for the people that suffers the angina pectoris, or is known as chest pain, the propranolol dose is normally 40 milligrams twice or thrice a day. Then, in myocardial infarction patient, in the first 2 to 3 days, propranolol that are given is 40 milligrams 4 times daily. The day afterwards, the given dose is 80 milligrams twice a day. Last but not least, in the treatment of the cardiac arrhythmias, or commonly known as abnormal heart rhythm, the propranolol given is about 30 to 160 milligrams in divided doses. So now let us move on to the next part of our video, which is clinical trial. We are discussing on the phase 2 clinical trial on the propranolol drug in newly diagnosed breast cancer patients that will be undergoing neoadjuvant chemotherapy prior to surgery. There were only 10 participants enrolled in this trial. This trial involves the treatment with standard chemotherapy and propranolol. This trial is being done by the previous laboratory work and has shown that the propranolol may decrease the ability for the blood vessels around breast cancer cells to grow, which may be important in helping cancer cells grow and reduce the possibility for the breast cancer cells to spread. These group of patients in a clinical trial will receive 2 types of chemotherapy regimens plus propranolol treatment. The regimen 1 involves paclitaxel, which may be substituted with nab-paclitaxel and given with pre-medication. The regimen 2 doxorubicin, which may be given with anti-nausea therapy, and cyclophosphamide, which may be given with pegfilgrastim. Propranolol starting dose is 20 mg twice per day. However, propranolol dose is up titrated to 40 mg twice per day to 80 mg daily with chemotherapy depending on tolerability. Tolerability is assessed every 2 weeks. After you complete all chemotherapy plus propranolol treatment, you will then have surgery to remove the breast tumor. Next, we are going to continue with the phase 3 beta blocker heart attack trial on the propranolol drug. The targeted patients are those with one of these diseases and condition: arrhythmia, cardiovascular diseases, coronary disease, sudden cardiac death, heart diseases, myocardial infarction, myocardial ischemia, ventricular fibrillation. The objective of the clinical trial is to determine whether the regular administration of the beta blocker drug propranolol to people who had at least one documented myocardial infarction thus would resulted in significant reduction of mortality from all causes over the flow-up period. The patients were recruited to participate in a double-blind clinical trial within 21 days after the onset of the acute event. One half of the patients were randomly assigned to a propranolol and another one half of patients to placebo. The trial also evaluated the effect of propranolol on incidences of coronary heart disease mortality, sudden cardiac death, and non-fatal myocardial infarction plus coronary heart disease mortality in persons with documented previous myocardial infarction. Next, we will move on to the drug manufacture of propranolol. In synthesizing propranolol, there are various ways that can be carried out. However, we will explain the steps in synthesizing propranolol from alpha-naphthol. This process will undergo two steps. First, we will synthesize epoxide, which then we will proceed with synthesizing propranolol. This is the overview reaction of propranolol. The process starts off with transferring alpha-naphthol and potassium chloride into a round bottom flask and adding ethanol and water with a ratio of 9:1. After dissolution, dropwise of epichlorohydrin is added, then leaving the reaction to be stirred with the magnetic stirring at room temperature. Ethanol was then removed by vacuum evaporator. The aqueous phase with ethyl ether was extracted, which then dried with anhydrous sodium sulfate. Filtration was carried out to obtain the crude brown oil. The crude brown oil is then transferred with methanol to a round bottom flask and added with isopropylamine. Solvents was then removed using vacuum evaporator. Hydrochloride acid is then added. The solution is then extracted using ethyl ether. The aqueous extract is transferred to an Erlenmeyer flask and alkalinized with sodium hydroxide. In an ice bath of 0 degrees Celsius, the extract is vigorously stirred to precipitate the product. The precipitate is filtered and dry in a vacuum desiccator and recrystallize from petrol ether. In a large-scale production of propranolol, it is classified under chemical synthesis processes using organic and inorganic chemicals. The process normally involves a number of stages with intermediate compounds being formed before the final API is synthesized. Synthesis is undertaken within a series of reactors, often multi-purpose reactors which may be used to manufacture a number of API. The products are isolated by extraction, crystallization, and filtration. The finished products are usually dried, milled and blended. There are several concerns on the side effect of propranolol. The common side effects of propranolol are slower heart rate, diarrhea, dry eyes, hair loss, nausea and cold hands or feet. These effects are usually mild and fade within days or few weeks. If the symptoms become severe, talk to your doctor or pharmacist, as propranolol is a non-selective beta blockers. It will act on the beta-2 receptors in the airways and cause bronchoconstriction. Bronchoconstriction will lead to shortness of breath, breathing difficulties and chest tightness. So, asthmatic patients are recommended to take beta blockers other than propranolol, usually selective beta blockers. Next, propranolol also causes drowsiness. Plus, as it lowers the blood pressure, patient may experience dizziness upon standing. So, avoid driving or handling machinery after taking this medication. Alcohol will add to the blood pressure lowering effect of propranolol, and you may experience headache, dizziness, lightheadedness and fainting. So, avoid using alcohol if you are taking propranolol. Apart from that, propranolol also can cause insomnia, the difficulty of falling or staying asleep, because they suppress the nighttime melatonin which is produced by the body to help sleeping process. From finding, 1 in 3 people who used propranolol get a lot of fatigue. Propranolol reduces the heart rate, so the amount of blood pumped by the heart reduces, causing inadequate oxygen supply to the organs. Propranolol blocks the beta-2 receptor that stimulate hepatic glycogen breakdown and increasing heart rate. Because of its ability to suppress glycogenolysis and mask the symptoms of hypoglycemia such as tachycardia, it must be used with caution by diabetic patients. If you are experiencing the mentioned effects, do not withdraw the drug abruptly. Because when you take a beta blocker, your body becomes used to it. Stopping it suddenly could cause problems such as palpitations, a recurrence of angina pain, rise in blood pressure, risk of heart attack and sudden death. Therefore, if the medication is required to stop, it must be done appropriately only with medical advice. Last but not least, please tell your doctor if you are taking other medications as stated, pregnant or breastfeeding, and having reduced liver, kidney, and heart function.